So trauma is a really important topic to think about when we're thinking about difficult fertility journeys or loss. 1 in 3 miscarriages are said to cause trauma symptoms or PTSD. And obviously with difficult fertility journeys and depending on the type of loss, those probabilities might increase or decrease a little bit, but there's a really high chance that the brain is going to struggle to process that experience of losing a much wanted baby. So let's talk a little bit about what trauma is and how it affects you. So I've mentioned PTSD there, or post-traumatic stress. So just to describe or explain what that is. So post-traumatic stress disorder is something that we often associate with veterans, soldiers, people who've been in major one-off incidents like car accidents or assaults. And it's the type of event that often the criteria for PTSD is that we would consider at the time of the event our life to be in danger or somebody else's life to be literally kind of in danger at that point. So thinking about the loss of a baby, it meets that criteria. And then for post-traumatic stress disorder, it also, a person would need to exhibit symptoms in 3 different areas. So the first one is avoidance, so things that are difficult for you because they remind you of the trauma. You are coping with the emotion that provokes and how difficult that is by avoiding. So that might be if your loss happened in hospital or you found out that your loss happened in hospital, for example, it might be that you avoid watching any programmes on TV that involve hospitals. You might avoid pregnancy or birth, not just because it's difficult, because that person is welcoming a child and obviously you want to be welcoming a child, but also because it literally is reminding you of that event. So with people with car accidents, often they might avoid the scene of the accident or the road that they went down, or they might be worried about red cars if it was a red car in the accident. So it's something that's kind of similar that you need to avoid because it just feels too difficult emotionally. So avoidance is one domain. With PTSD, you'd also have hypervigilance or hyperarousal. That means you're more kind of anxious or jumpy or kind of more easily alarmed, and your emotions are kind of heightened as a result of that experience, and just noticing kind of how different you feel on a day-to-day basis as a result of that hyperarousal. And then the final area is intrusions. So you'd be experiencing things that are popping into your mind without you meaning to or wanting to. So that might be thinking about the moment at which you found out that you lost your baby, or that seeing that pregnancy test and seeing that it's negative, or so it might be the moment you found out, it might be the point at which you realise that the health of your baby is jeopardised, or that you've been told that you might need to kind of terminate. It might also be to do with the care that you experienced at the time. So for some people it's not finding out, it's actually the labour, or the fact that people, kind of lots of people talk about being left to it. So someone tells you that some tragic news about the loss of your baby, and then they kind of leave and go, okay, I'll just give you some time or space. And lots of people might feel kind of abandoned with that, or not supported in their labour because people have left them to it, etc. So there's various points at which could be kind of traumatic and causing that. But if you have PTSD, we would recommend one of 2 approaches for that. So the National Institute of Clinical Excellence, or NICE, recommend either EMDR therapy or trauma-focused CBT. So trauma-focused CBT is different from generic CBT. It is specifically for trauma and involves going through the difficult event that you're kind of running through. You'd run through it and kind of desensitize yourself to how difficult that is emotionally, but also if there's any ways in which you're thinking kind of unhelpfully, or that the meaning could be changed to improve coping, then you might do that. So for example, using the car accident example, if someone was in a car accident and they thought at the time, I'm going to die, but actually they didn't die, it might be really helpful using trauma-focused CBT to kind of update the memory with, okay, it was really scary at the time, but that worst thing didn't happen. Now, personally, I find EMDR, which stands for Eye Movement Desensitization Reprocessing, to be more helpful for people who experience difficult fertility journeys or loss, because often there isn't a meaning that needs updating or has been wrongly interpreted. You know, if your fear is that you are going to lose your baby, and actually you did sadly lose your baby, then of course, you know, there's no way of rewriting that or making that okay. So EMDR, as I said, stands for eye movement desensitization reprocessing, a bit of a mouthful. What that means is during the therapy, you go back and think about what was difficult for you, but at the time your eyes move, and that is to imitate. You know, we often process in our sleep, so things move from our short-term memory to a long-term memory in our sleep, and that is during REM sleep, which stands for kind of rapid eye movements. So the EMDR is about stimulating your eyes to move in a way that kind of manually gets your brain to process what's been stuck and not been fully processed the first time. So that might be by someone moving their hand across so that you look from left to right. It might be someone kind of encouraging you to tap yourself if it's kind of virtually. Any method in which your brain goes from left to right and manually tells itself to process that difficult life event. And I find EMDR can be so incredibly helpful for people after they've experienced loss or difficult fertility journeys. You know, invasive treatment can be quite, you know, traumatic for people during the process of fertility treatment. Again, the treatment or the words that people use can be very insensitive. It might be processing those moments within your care. And many people that I support through one-to-one work will benefit from, even if it's only 1 or 2 sessions of EMDR, most people will benefit from a bit of EMDR to process what was the most difficult aspect of their loss or their failure to conceive on that moment, because the treatment wasn't kind of effective for them that time. And personally, after I lost my daughter Jessica, I know that I accessed EMDR. I'd worked in a trauma service for 6 years. I was very aware of how much EMDR could help people, and I knew that it would be helpful for my loss. And after a couple of sessions, it hugely kind of improved anxiety, and I could notice a massive difference. So I'm a real advocate for EMDR, and I think, you know, even if it's 1 or 2 sessions, it's can make a massive difference, and that's not hugely costly. And if you don't process the trauma and that trauma is still there, what it does is it keeps the emotions live to a point at which they were at the time. So many people who are kind of traumatized or experiencing trauma symptoms will say, I feel as awful, or when I think about that memory, those emotions are as strong now as they were at the time, and it literally can feel like it's happening again, or it can take your breath away in the same kind of way that it did then. Whereas for those who've had EMDR or kind of processed their loss naturally, very often once kind of there's a period of time has gone on with the grief, they can get to a stage where they say, okay, I know that was hard and will always be hard because it's the point I found out that I haven't conceived or I've lost my baby, but I don't feel the level of emotion kind of as strongly now. It doesn't feel like it's happening again. It feels like then it was really hard and that was really difficult, and I wish I could change that, but I'm coping as best I can now, or I'm okay now. It doesn't feel like it's literally kind of raw and happening again. So I'm a huge advocate for EMDR, or for at least considering whether there might be an element of trauma in your loss. I think, lots of people think, oh, well, it wasn't traumatic, or, it wasn't like that. It's not like I was in war, or, but actually all types of loss, miscarriage, unsuccessful cycles of fertility treatment, etc., really can be traumatic. And I can't recommend enough that it's helpful to at least get an assessment of your trauma if you feel like that might be part of the process for you. The other thing that lots of people experience after trauma, as I said, I kind of talked about that hypervigilance or hyperarousal. If I explain a bit, something called the window of tolerance. So the window of tolerance is when all of us have, say our emotions are kind of within say this is our window, and our emotions fluctuate kind of up and down within that. When we experience a trauma, what happens is our amygdala, which is the kind of alarm for danger almost, that's the bit that triggers our kind of fight-flight response, and that will make us more likely to become anxious or angry or kind of overwhelmed by emotion. That window of tolerance and how much we can cope with emotionally narrows after a traumatic event, and effectively what the brain is saying is, I didn't quite stop that trauma quick enough last time, so if I'd have gone into fight-flight quicker, maybe I'd have stopped you that awful thing from happening. So if we haven't if you haven't felt that emotion and responded quick enough, maybe I need to make you feel that emotion stronger and kind of exaggerate it. So what people might notice also with that kind of, with trauma symptoms, is that suddenly you're feeling emotion much more strongly, you're very irritable, you're very quick to anger, you're kind of really struggling with that anxiety. And it's a sign that that window of tolerance has narrowed to the point that emotions that would naturally fluctuate during the day, instead of now being in the tolerable level, have taken you outside and are overwhelming, or kind of below the level of that window is what we call hypoarousal. So it might be where you feel nothing, kind of numb, or it's almost like you feel no emotions. Your body's going into a kind of shutdown to protect you from that emotion. So trauma work can be really, really helpful for naturally widening that window back out, stopping you going into that fight-flight response too quickly and too easily, when actually it's not necessary, because that really can leave the process of grief lasting longer and being much more difficult, and make you more likely to kind of use those avoidance strategies. So I think that's something really important to consider if you have had counselling and you felt like actually it's not made the level of difference that I thought it might need, or you think that some of those trauma symptoms kind of might be relevant for you, then do assess whether there might be some trauma there, or at least kind of seek someone out for a one-off assessment of might this be helpful for me.